Welcome to the Researched RN podcast. I am your host, Steven Cuzmenco. In this podcast, I discuss new and interesting peer-reviewed research articles from various nursing researchers and other professional publications. In this sixth episode, I'll talk about an article published in the July 2024 edition of Nursing and Health Sciences titled Relationship Between Missed Nursing Care and Patients' Trust in Nurses and Satisfaction with Care, a cross-sectional study. It's authored by Caradas and colleagues. To begin with the background, we know that care is essential for everyone, and it's a universal characteristic of all human beings. Care is not only found in nursing, it's in varying degrees in all professions, but it's integral for the nursing profession. Just like I want the best care for myself, you want the best care for you, we want the best care for our families, friends, and loved ones. Missed nursing care is defined as, quote, the partial or complete omission or delay of the care required by patients, end quote. This could mean that care is incomplete or partially missed or partially completed or for some reason not fulfilled. Some of the contributing factors to missed nursing care, many of these will not be new to you, but nurses' heavy workload, inadequate staffing, and an unsupportive work environment or atmosphere can contribute to missed nursing care. And missed nursing care is associated with poorer patient outcomes, less satisfaction for nurses in the workplace, and lower patient satisfaction. The authors explain that most of the research in missed nursing care is centered around the perception of nurses and not necessarily the patients. So therefore, the authors sought out to answer two research questions in this study. First being, what are patients' perceived levels of missed care, trust in nurses, and satisfaction with nursing care? The second research question was, is there a significant relationship between patients' perceived missed care and their trust in nurses and satisfaction with nursing care? And so as we move on to the study design, the sample, and the tools that were used to answer these questions, the authors designed a descriptive and cross-sectional study. The study was conducted in hospitalized cardiac patients at a research hospital in Turkey. Inclusion criteria for study participants were being aged 18 years or older, being conscious, and agreeing to participate in the study. And the last inclusion criteria was that the patients had to have a hospital stay of at least 3 days. The researchers chose a minimum of 3 days in the hospital because they felt that that length of time would provide an adequate opportunity to experience nursing care. Otherwise, there was nothing too special about 3 days. There were 350 patients included in the final data analysis of the study, and the data was between June of 2022 and December of 2022. The data the researchers obtained from the study participants was a descriptive informational form that mostly included demographics and some questions about medical history. And then the tools they use that get us into the findings of the study. The first one was the Miss Care Survey. That's reflective of the missed nursing care. The Trust in Nurses Scale, and that measures what you think it measures, the level of trust in nurses. And then the Newcastle Satisfaction with Nursing Scale, which also measures kind of what it's named after, the satisfaction in nursing care. So now we move on to the results of this study. The mean age of the participants was 61 plus or minus 14 and a half years. So mostly middle age to maybe some more older aged adults. The majority of the study participants were married women with at least a high school education, and the vast majority of the study participants, 84.6% of them, had a history of hospitalization, and over 65% of them had a chronic disease. So, I would imagine that this type of sample would be well acquainted with being in the hospital, and with that comes knowing the type and quality of nursing services that are provided to them. So right off the bat with the results, it does appear that this sample had a high trust for the nursing care provided to them. With the trust in nursing scale, the minimum score is 12 and the maximum score is 24. And the average score reported from this study sample was 21.97, essentially 22. So with 24 being the max, they did report a high degree of trust. With the satisfaction in nursing scale, the lowest score could be 37 and the highest score could be 95. And in this study, the average score reported from the study participants was 78.92, essentially 79. So a pretty high satisfaction in the nursing care provided. For the MIS-CARE survey, the minimum score that could be given is 1.77 and the maximum score is 4.38. I don't know why those numbers are so specific, but they are. The average score reported from this study sample was 3.02. So for the most part, this study sample was overall satisfied with the care given to them and trusted the nurses. And the degree of patient perceived miscare was pretty low, but there was definitely areas for improvement in all aspects. These scores were not perfect. So let's move on and get into the relationships between the surveys and the scales that I just talked about. So one of the first things that the researchers reported was that there was a strong positive correlation between the overall scores in the trust in nurses scale and the Newcastle satisfaction with the nursing scale. In other words, if the nurses reported a high degree of trust, they were more likely to report a high level of satisfaction. There was a strong negative correlation with the trust in nurses scale and the Newcastle satisfaction in nursing scale and the communication subscale questions of the MIS-CARE survey. So that tells me that if communication was perceived to be poor, then trust and satisfaction in nursing care would be lower. There was a slight negative relationship between basic care and trust in nurses. So I don't think this is groundbreakingly new knowledge, but that tells me that if basic care was not provided, then there was less trust in nursing. And this theme of proper communication and basic care continues. There are 3 subsets in the MIS-CARE survey. Those are 2 of them. They explain 28% of the trust in nurses score. Over a quarter of the trust in nurses was attributed to communication and basic care, with communication being the stronger predictor of those 2. Even more revealing but not surprising was that communication and basic care explained 40% of the Newcastle satisfaction in nursing scores. And also not surprisingly, communication being the best predictor of lower patient satisfaction scores. There were some adverse events reported by the patients as a result of the missed nursing care, with the most common being IV occlusions occurring in almost 25% of the sample. IV infiltration reported in just over 10% of the sample, falls reported in 9%, and new infections reported in 5% of the sample. And in this study, there were no reports of pressure injuries or medication errors as a result of missed nursing care, but I am sure that there are other studies that have those findings. And so those are all the results, and now we can move on to the discussion. I'll point out some of the ideas that the researchers discussed in this section, but I'll also share with you my thoughts as well. We know that it's important that we evaluate the level of trust in nurses and our patients' perception of the care, which is what this study was. It's important that we do these kinds of studies so that we can improve care and optimize patient outcomes, which is why the researchers did this study. This study and many others have demonstrated a relationship between nurse-patient trust and patient satisfaction with nursing care. This study also demonstrated that there's a relationship between how well nurses communicate and the degree of missed nursing care, or at least the perception of missed nursing care. One of the many things that I found interesting in this study is that communication over timeliness was a better predictor of patient trust and satisfaction. So even if you might be behind on your shift or you are understaffed, if you are communicating well to your patient, then in my mind, you should still be able to maintain some degree of trust and satisfaction. But this will likely need to be another study conducted in areas that have frequently low staffing or inadequate staffing ratios. And overall, I think we know that communication and developing a strong nurse-patient rapport is necessary for great patient care, and just goes to show that these results do support that. Some of the limitations of this study: the data revealed the personal experiences of patients. So this data is subjective, which makes it prone to bias. Additionally, the data only reflects patients that agreed to participate. It would be interesting to see how many total patients were admitted and seen in the nursing unit in the study period versus the 350 included in the analysis. I don't know that information. And so this data does not reflect the experiences of patients that did not participate. And then lastly, the data from this study is reported from a single center in Turkey. And so we don't know how well this can be generalized to the broader nursing population outside of even maybe Turkey, that hospital that did it in Turkey, but definitely the world and the United States and England and Australia and all of the countries in the world. We don't know exactly if this is representative of those populations of nurses. There's millions of nurses and thousands of hospitals all around the world. So in my opinion, I think it would be helpful for this type of study to be done elsewhere, especially on a larger scale. I think the researchers of this study would agree with that. But still, nonetheless, this information is at least good to think about for your practice. And so here are some of my thoughts. I know that it wasn't the purpose of this study, but some information I would have found helpful would be how many total nurses were on the staff and maybe an approximation of how many of the nurses on the staff actually took care of these 350 patients. So what I mean by that is, let's make it easy and say that there was 100 nurses in the practice setting that was studied and only 80 of them cared for the 350 patients, or maybe only 50 of them, or maybe it was the entire staff, but we don't know that information. Additionally, I'm coming at this, my perspective is a clinical nurse educator. I think it would have been helpful to know the level of experience, the educational preparedness, and maybe some of the information included in the orientation of the nurses for this study. I know that wasn't the purpose of this study, but they do say that nurse leaders should use this information to inform their policies and procedures and help improve patient care. So maybe it comes down to, is it a training deficiency? Is it not a training deficiency? So again, more information that is not reported in this study. Those are just some of my thoughts and my reflections. And so the big takeaway for your practice I want you to think about is missed nursing care isn't about just delays. It's about patients feeling neglected. And this study underscores communication as a linchpin in trust building and care satisfaction. Nurse leaders and nurse educators can use these insights to develop strategies for real-time feedback and continuous care audits, and to really even discover the degree of patient perceived missed nursing care at your respective institution. I'd really encourage you to read this article and look at the main aspects of missed nursing care. There's definitely more information in this article that I just didn't have time to discuss. Missed nursing care was a new concept for me that I previously wasn't aware of, but after reading about it, it really does make sense. If you do read this article, I hope it creates more questions in your mind regarding the relationship between these aspects of nursing care, as well as what missed nursing care really means. This would be another great article for you to share with the people you work with, and honestly, wouldn't be too hard to conduct a similar study at your institution to see the degree to which patients at your institution have trust and satisfaction in the nursing care. And kind of as I mentioned a little bit ago, how often missed nursing care is occurring. And that is a wrap on the 6th episode of the Researched RN podcast, your virtual journal club on the go. I am your host, Steven Cuzmenco. I'll have new episodes out at least monthly, and you can email me at researchedrnpodcast@gmail.com with any articles or topics you'd like for me to discuss. And if you actually do read this article, I'd also love to hear about that, even if you don't have anything else to share, but especially if you have more to share. Thanks for listening, and be sure to tune in to the next episode.